Hello, I'm Dr. Maurie Markman from City of Hope, and I'd like to present briefly a very interesting paper, and one that I think as clinicians and certainly as researchers, we need to take very seriously in terms of the broader implications beyond what the researchers in this study reported. The paper itself is entitled Readability of Patient Education Materials in the Head and Neck Cancer, a Systematic Review. And this was published in JAMA Otolaryngology, Head and Neck Surgery earlier this year. What these researchers did was they did an analysis of the literature that looked at the question of two parts. The population itself of head and neck cancer patients, the term they used was health literacy, and they were actually looking at a variety of formats to define health literacy. And they identified inadequate health literacy, or suboptimal, in anywhere from 12 to 47% of the patients, meaning, obviously, how much do they know about head and neck cancer? The second part of this survey was an analysis of the readability of the material that had been prepared for patients to explain treatment, the disease, prognosis, etc. And what they looked at here was, in fact, 17 studies that are published on the topic. I should note that the health literacy question, there were 8 studies that reported on this topic that said 12 to 47% of the patients had suboptimal health literacy. But in the readability material, they noted that the mean grade level, and there are objective criteria, researchers in this area that said, what educational level are we at in terms of the material? They said the mean grade level was 8.8 to 14.8. So we're obviously talking about, junior high level all the way up to college level. That was the mean level of this material. It should be noted, and this has been stated many times, that the American Medical Association has recommended that grade level for this material be at grade 6 or lower. That is consistent with some of these health literacy questions. So here we have evidence in this patient population. Again, data published in the literature. Not going to either comment on or challenge the metrics that are used, but that a third of patients have some issues with understanding about what's going on relative to the disease. A recommendation by the AMA to have the material at grade 6 or level, and the mean level is not even close to that in this material. So I think we should pause and think about who is preparing this educational material, at what level, and making sure that we are providing the information that is essential for our patients to understand the disease, prognosis, possible treatment options, particularly when there's so many options and decisions patients have to make. Patients and their families need to be informed. They need to be actively involved in the decision-making process. And if the material we're preparing them to look at this, and their families look at this, is somehow not interpretable, we need to think about how to do a better job. And I thank you for your attention.